So pushing the conventional chemotherapy had let us achieve a cure rate of over 90% now, in fact, probably 92%. However, a recent study showed that we have reached our limit. Further intensified chemotherapy will result in more toxic death. Therefore, even though we may prevent additional relapses, but we won't improve the cure rate. And therefore, with the recent advent of novel molecular therapeutics and good immunocellular therapy, we can further improve outcome by replacing toxic chemotherapy with those novel agents. And the time is now that we should start using novel therapy. In this regard, actually, adult oncologists are leading the way. So we pediatricians should really start learning from adults how to use molecular therapeutics and immunotherapy in combinations to push the envelope forward. So I think that we can cure the remaining 5 to 7% of the patients. At the same time, we can improve quality of life of our childhood survivors. It is important because we want to cure 100% of the patients. As long as there's a child die of leukemia, it's not acceptable to us. And also, we found out it is getting more and more difficult to take care of children receiving intensive chemotherapy because they get really sick. And as a pediatrician, we really hate to see that. So we want our children with leukemia survive with good quality of life. We want to reduce both acute and late side effects. Actually, one of the recent studies published by us on total 16 protocol. This protocol has enrolled over 600 patients treated since 2007. In that protocol, we intensified treatment and further improved the event-free survival by 2%. However, we did not improve survival rate because the decrease of relapse is counteracted by the increased toxicity. And this study tells us that we are pushing the chemotherapy to its limit. So any gain from the decreasing relapse rate was counteracted by increased toxicity and toxic death. Yeah, and also recently Chinese reported a study using a second generation of tyrosine kinase inhibitor. It showed that the newer generation of tyrosine kinase inhibitor can improve the outcome of a high-risk subgroup of patients with Philadelphia chromosome-positive acute lymphoblastic leukemia. And the newer generation of tyrosine kinase inhibitor further decrease the relapse, and more importantly, can cure Philadelphia chromosome-positive ALL without the use of cranial irradiation.